Hi, my name is Mike Acevedo. Today I'll be performing trach care for my patient here today. I have my supplies here, my trach kit, and my clean gloves. There. First and foremost, we're going to perform hand hygiene. We're going to go ahead and assist the patient up to a comfortable position, which is semi-Fowler's or high Fowler's, whichever is comfortable for the patient. We're going to go ahead and suction the patient as needed. At this time, the patient doesn't need any suctioning. Next, we're going to go ahead and open our trach kit. We always remember the trach kit's sterile and has to remain sterile. So we're going to open up the trach kit. Next, we're going to go ahead and get the drape, just touching the borders of the sterile field, and opening it up and placing it down. Still want to remain sterile. Go ahead and leave it here. Okay. Once I've done that, I'm going to go ahead and empty the contents of the kit onto the sterile field here that we have here. I want to be careful and remain sterile. So, the kit. Next, we're going to go ahead and get our hydrogen peroxide and normal saline, so that we can soak our inner cannula in and our cleaning solution as well, which is just normal saline. So I'm going to go ahead and get the 50-50 solution, hydrogen peroxide, half hydrogen peroxide, and then half normal saline, and then normal saline on the two bottom compartments. We'll go ahead and place that to the side. Once we've got our solution ready, now we can go ahead and remove the inner cannula and the dirty dressing, or the dressing with debris on it. So place our clean gloves on. Next, we're going to go ahead and unlock and remove the inner cannula. We want to make sure that we pull away from the patient and follow the curvature of the cannula. Then we're going to go ahead and place this into our solution. Let that soak in there for a little bit. Next, we're going to go ahead and remove the dirty dressing. And then we're going to go ahead and discard that. Once we remove that, we can go to remove our gloves. Discard that. Next, we'll go ahead and perform hand hygiene again. As we're going to go ahead and get our sterile gloves ready. So we're going to go ahead and get the sterile gloves. So remove solution. This way a little bit. Get the gloves, and I want to make sure it's still remain a sterile field. I'm going to grab the tabs that are here. I'm going to go ahead and open that up. Side. Next, we're going to go ahead and grab with our less dominant hand the outside or the inside of the glove. Place our glove on. The gloves can be a little sticky at times. Now that I got my glove on, I'm gonna go ahead and grab the inside of the inner cuff of the glove. Then I'm gonna go ahead and place my hand into it. Now that we got our sterile gloves on, now we can go ahead and discard our wrap into the trash. So with the right hand, it's gonna be my sterile hand, and the left hand is gonna be my dirty hand. So now I'm gonna go ahead and get my items that I need. So first, now that we have the inner cannula soaking in the solution, we're gonna go ahead and get our wire brush, or our little brush that we have here. And then with my my sterile hand, I'm just gonna go ahead and get the cannula. And then I wanna go ahead and get the cannula and clean any debris off of it. You can throw this one away. After we throw that away, we can go ahead and replace the inner cannula, and we want to follow the curvature again. And lock it in place. And then we're going to go ahead and get our gauze and soak it in some solution. I mean, not our gauze, our little Q-tips that we have here. And I'm going to soak that into the normal saline solution. Next, we're going to go ahead and get, one Q-tip, and I want to go ahead and clean around the incision site of the trach. That's gonna go. Throw that away. We also want to make sure that we have. Usually we do with two people to help make sure that the trach doesn't come out or anything like that insecure. But right now it's secure because of the string or cord that's holding it in place. Next, we're going to go ahead and get our other swab and clean incision site. Get any corrode card, throw that away. Next, we'll go again and get that. Last one, throw it away. Now that we have done that, we're going to go ahead and wipe the patient's area dry because of the wet solution. Again, this is my left hand, my dirty hand, so it's okay. Put that away. Still remaining sterile at the moment. Throw that away. Now that we cleaned and replaced the site, we replaced the inner cannula, it's already secured. Next, we're going to go ahead and apply the sterile dressing to the trach site, and we're going to ensure the tube is still securely supported by when applying the dressing. So we're going to go ahead and get our sterile dressing here. Then I'm going to go ahead and replace it. Make sure that it's still in place, the trach, as we apply the T-gauze so that it can soak any drainage, things like that. Now that we've cleaned and applied a new dressing, now we can remove the ties and replace it with a new tie. Since everything's already done, sterile, we did all the sterile part, we can go ahead and remove the old ties. Go ahead and remove the padding that was applied to prevent any pressure sore around the neck area. Throw that away. Next, we're going to go ahead and remove the ties from the patient. Usually, if the patient's alert and oriented, we can ask the patient to hold the trach site so it won't get dislodged. Because at times we have to teach them before discharge on how to do this, because they won't have a nurse at home to do this. They can have assistance from a loved one or a family member, or if they have home health, they can always have a nurse come out and do that for them. So of course, again, making sure that the patient's holding the trach, or if you have a partner here, as we remove the old tie. Now that remove the old tie, you can go ahead and throw that away. Now it's left is just get the new tie and secure the trach in place. So we're going to go ahead and feed the tie. Go ahead and double knot this. On one side. And then go ahead and go around the patient's neck. On to the other side. Over. want to make sure that we do have at least 2 fingers, about a finger and a half. Around the patient's neck, so it's comfortable, and but still remaining intact so that it won't dislodge the trach tube. Next, we're going to go ahead and tie it off here. Once we have it tied off on that side, it's double knotted, it's secure. We're gonna go ahead and get some gauze and wrap it around the patient's neck so that it's not irritating the patient's neck. I'm gonna go ahead and wrap that. I'm gonna get our tape. We're not gonna tape to the skin. We're gonna just tape the gauze around the gauze so that it's secure and comfortable around the patient's neck. Once we have that, it should look something like this on this side. After we're all finished, we're gonna go ahead and return the bed to the lowest height where the patient's comfortable. We're gonna go to remove our sterile gloves. After we remove our sterile gloves, of course, we're gonna go to perform hand hygiene. And replace the patient's call light so he can call us if he needs any help. And of course, remove all the trash that we have in place. Again, after that, perform hand hygiene again. We'll go ahead and reapply the patient's oxygen as well. And document and chart, and then that's about it.